Bye guys, I'm leaving.
Aww. Have fun on maternity leave.
Thanks.
Send us pictures.
Bye.
Bye.
Congratulations.
Thank you.
See ya.
See ya.
All right, Kayla, you've been gone for a while on maternity leave, but we're so happy to have you back. But we're getting ready to go change a central line dressing on a patient. I just want to review what you remember from the last time you were here. It's been a few years.
All right, so I'm going to walk into the patient's room. I'm going to wash my hands. I'm going to go over to the patient, make sure she knows what we're going to do. I'm going to put her hair over on one side, the side not next to her catheter. And then I'm going to take an alcohol prep pad and unscrew the cap that goes onto it. And then I'm going to wash that down with the alcohol prep pad.
Okay, actually now, since you've been gone, we use these. They're called scrub hubs. Scrub hubs have been shown to lead to fewer Klebsiella infections for central lines. So now we use these instead of the alcohol prep pads, which we used to use because they're just cleaner. Evidence-based articles, peer reviews have also shown the same.
Okay. So after the catheter port is closed, I am going to take off the Tyderm, and I'm going to use, what's that stuff called? Not betadine, but...
Chlorhexidine.
Okay. So I'm going to use chlorhexidine and circular motion.
Okay, actually now we've changed that. We used to start from the center, work our way out with chlorhexidine. Now you just start from the center and you rub back and forth a good 2 inches on either side of the access port. You rub kind of hard back and forth in just a zigzag pattern. CDC and evidence-based articles have also proven that that's a better method of cleaning versus the circular motion from inside out because there wasn't enough friction to actually kill infection.
Alright, so when all of that stuff is done, we're going to reconnect the tubing, and then she'll be good to go.
Alright, and just remember to always maintain sterile field, use clean gloves when removing the Tegaderm, and then put on your sterile gloves and continue with the rest of the procedure. We'll be done.
That sounds good.
You ready to go?
Yeah, let's go. Hello.
Hi.
How are you?
I'm good. How are you?
Good. My name is Kayla. I'm going to be your nurse today. This is Bridget. She's going to be helping me out. I just got back from maternity leave, so I'm a little bit out of things, so she's just going to make sure that I'm up to par on what's happening these days.
Okay, sounds good.
Alright, so I'm just going to get ready.
While she's washing her hands, if you'll just put on this mask, and we'll get ready to do your change. Do you have any questions?
Is this gonna hurt?
No, it shouldn't hurt at all. The only pain you might feel is when we remove the Tegaderm, it might stick a little, and that kind of thing, but nothing too severe.
So you guys are gonna remove her central line?
No, we're not removing it, we're just changing the dressing.
Does she need a mask too since she's gonna be in here?
No, she's not in close proximity to the central line dressing change that we're doing, so she doesn't need a mask.
And I'm just going to move your hair out of the way. On the side there. Looks good. Thank you. Alright, just expose this just a little bit. Alright. So I'm going to go ahead and take this off here.
Yep, get your scrub hub out.
Okay.
There you go.
So now I'm going to take this Tegaderm, it's the tape that's on your skin, I'm going to take that off now, okay?
Okay, so make sure that you're facing toward your friend. Okay.
Alright. Put my mask on here.
Take the gloves off. There you go.
so now I'm gonna set up my sterile field.
Okay, I'll take this out of your way. There you go. And put on your sterile gloves.
Okay.
Okay. Now that's your chlorhexidine, so go ahead and open that. And remember, we reviewed the technique that you needed to use.
Okay, so this is the chlorhexidine. This is the part that might be a little uncomfortable. I have to rub it pretty thoroughly.
Okay.
Might be just a little bit cold, okay? Should we use that for a square?
Yeah, scrub.
Should I break it?
No.
Is it necessary to scrub that hard every time?
Yes.
Yes.
The friction plus the chlorhexidine are what prevent the central line infections from happening.
Okay. It doesn't really hurt, just seems like a lot.
Yeah. So you want to make sure that you get a 2-inch circumference around the insertion site.
So then I'm going to put the Tegaderm back on.
Well, first you're going to put the bio patch on, and that goes around the insertion site.
Okay.
Make sure you do the blue side up and the white side down toward the patient. Now we're going to apply the Tegaderm. And we use clear Tegaderm so that you can easily view the insertion site to monitor for any redness, irritation, swelling, or rash.
What are those signs of?
Those could be signs of a central line infection.
Okay.
All right, now remember to sign and date your Tegaderm.
Okay.
Yeah, here's.
Thank you.
So if we do see one of those signs, what should we do?
If you start to see redness around the insertion site or start to have pain at the insertion site, spike of fever, have chills, or just generally just don't feel well, you should use the call bell, call the nurse, and we'll come in and take a look at it. Sometimes redness and irritation can be just because of the cleaning that we had to do because the friction is kind of rough, or you could be having a reaction to the Tegaderm itself, so we'll come in and take a look at it. And we're done.
So can I take my mask off now?
Yep, you can take your mask off now. You guys have any other questions?
I think so.
All right. Thank you.
Thank you.
Thank you guys.